Body dysmorphic disorder. What is body dysmorphia? The definition of body dysmorphic disorder is a physiological disorder in which a person becomes obsessed with imaginary defects in their appearance. How does it affect people? BDD is a mental illness involving obsessive focus on a perceived flaw in appearance. You can't stop thinking about this flaw or flaws, even if it may be minor or even imagined. But the person may spend hours a day trying to fix it. They may try many cosmetic procedures or exercise too much. They may feel so embarrassed, ashamed, and anxious that they avoid many social situations. BDD often develops in adolescents and teens and affects both men and women equally. This normally starts to occur around the age of 12 to 13 years old. The brains of people with BDD have abnormalities in processing visual input, particularly when examining themselves. Research has also found that the same systems of the brain that are overactive in both BDD and OCD suggest that there is a link between the two. What are the signs? People with this disorder may frequently examine their appearance in a mirror, constantly compare their appearances with that of others, and avoid social situations or photos. People may also experience anxiety or general disconnect, unwanted thoughts, compulsive behavior, or depression. What are the abnormal behaviors and/or thoughts? Some signs include someone focusing too extreme on their looks. They find it hard to stop thinking about the parts of their looks that they dislike. Next is feeling upset about their looks. They feel worried, stressed, anxious about their looks almost all the time. The need to check or fix their looks. They feel a strong need to check their looks over and over and ask others how they can fix it. Next is trying to not be seen. They feel so bad about how they look that they don't even want to be seen. They may stay home or cover up with hats and makeup. Some people avoid looking in mirrors altogether because it is just so stressful. Lastly, it's having a false image of their look. They don't see their body as it really is or how others see it. They focus on flaws that others could barely even notice and feel so sure that they are ugly, even though that is not true. What are the treatments? Treatment may include therapy and antidepressant medication, specifically behavior therapy, psychotherapy, and cognitive behavior therapy. Medications that are given are SSRIs. It eases symptoms of depression, of a depressed mood, and anxiety. SSRIs are a type of antidepressant drug that inhibits the reabsorption of serotonin by neurons, so it increases the availability of serotonin as a neurotransmitter. Few examples are fluoxetine, which is Prozac, escitalopram, which is Lexapro, sertraline, which is Zoloft, and citalopram, which is Celexa. Those are just some of the antidepressant medications. Is this a curable illness? Although there are no medications specifically proved by the FDA, the Food and Drug Administration, to treat body dysmorphia, medications used to treat other mental health conditions such as depression and obsessive-compulsive disorder can be effective, and they were listed before. What are society's beliefs about the illness? I don't think a lot of people know about BDD or are educated about it. Today, it is important to educate society on it because it is already known that social media negatively affects people's perception of their body image. Although social media doesn't cause the disorder, it definitely can amplify the condition. Do they treat people differently that have this illness. Body dysmorphia isn't something someone can really look at and tell you that you have it. It is all in your own head. I don't think society treats people with this illness any differently, but people with BBD or BDD can become more introverted from society because of the way they feel about themselves or how they fear what others think about them. Overall, mental illnesses aren't always taken seriously and are overlooked as not that serious, but mostly that's just by the people who don't really understand them. Where can people find more information about this topic? More information is at the mayoclinic.com, and more information can also be learned from this app that was created in Massachusetts at the General Hospital. What are good resources or places where people can find help? Mostly any good therapist around you that does any of the behavioral therapies or the cognitive behavioral therapy. There are resources such as this hotline for New York and New Jersey that is linked there. And there's also the app I mentioned before is a therapy app, and it is free. So yeah, it is free to call and free to join this app if you need any help. These are the references. We want to spread body positivity because, yeah,